pressure was on. You know, as we got into like 20 hours, 21 hours.
At the hospital, I had Pitocin, and then that made me itchy, so they give you something else for your itching.
I knew once they gave you that Pitocin, you need the epidural.
Feel better now that you have your epidural? Oh my God, yeah.
And then things come on really strong, so then you get an epidural.
And if you're uncomfortable, we can always give you more.
It was very easy for them to start doing things that we hadn't really wanted them to do, like Pitocin and whatnot, because I already had the IV in my arm.
They don't really give you the option, you know.
And then another epidural, because nothing was happening.
You're having a contraction right now.
I don't feel pain.
Automatically, they were like, oh, you need an epidural. We'll get the anesthesiologist.
So she's getting her epidural, then we'll put in the Foley bulb for induction.
They gave me another drug called Stadol.
17 hours of Pitocin.
They gave me that, and I remember that made me, I was like, what's going on? What's going on? There's something wrong.
Cervidil is the end. Once Cervidil happened, any chance beyond that was gone. It was gone.
I hated that drug.
You know, it seemed to me that once they started an intervention, they all just kind of, it was a domino effect.
The whole thing is like a big snowball effect.
In the hospital, you're not allowed to have very long labors. So if you're not dilating rapidly, which you're likely not to do if you get an epidural early in labor, you will be given Pitocin. They'll put the Pitocin in the IV. It will flow into your veins. Pitocin makes contractions longer and stronger and closer together. So then the pain of labor is much worse. So you go with that for a while because you have the epidural, but eventually the pain of the contractions is overwhelming the epidural. You need to up the epidural, and then labor slows down more because of that, so then you need more Pitocin. Now you're not feeling the pain of the extra Pitocin because you've got the epidural, but your baby is getting compressed blood and oxygen supply because Pitocin contractions last so long and are so strong, the blood and oxygen flow to the baby is compromised. So then the baby's likely to go into distress, and then you're sent off for an emergency cesarean from a baby in distress from contractions induced by the Pitocin, which was necessitated by the epidural.
Step by step, one intervention leads to a series of interventions. And the net result is the mother finally ends up with a cesarean, and everybody says, thank God we were able to do all those interventions to save your baby. The fact of the matter is, if they didn't start the cascade of interventions, none of that would have been necessary.
If you look at obstetrics for the last 50 years, what do you find? In the 1930s, they were giving x-rays on every pregnant woman to measure her pelvis. And then in the 1940s, they discovered that that caused the baby to have cancer. So they had to stop it. And then in the 1950s and 60s, they had another drug called thalidomide, which caused babies to be born without arms and legs. And then they had to stop that. But you see, in every case, it was after the fact. In the 1990s, they were giving Cytotec to induce labor in women who had had a previous cesarean. And they ended up with hundreds and hundreds of ruptured uteruses and many, many, many dead babies before they found out, finally, in 1999, that they shouldn't do that. But you see, there's not a good history in obstetric practice of careful study of the long-term effects of all these interventions.
So concerns have been raised about the high level of cesarean section in the United States. We have one of the highest, not the highest, but one of the highest rates of cesarean section in the industrialized world. The most recent data from 2009 has the United States at 32.9% of all births end up in a cesarean. The difficulty with that is that there's no evidence whatsoever that a third of mothers are high risk, or certainly sufficiently high risk to merit a cesarean. When people have looked at this increasing cesarean rate, it's often argued that it's either because of demographic changes among mothers or mothers' requests for them. So let's look at this piece by piece. It's argued that mothers are getting older, and older mothers are at risk, higher risk, and so they require cesareans more often. Sort of true, except for the part that's false. The false part is this, that the increase in the average age of mothers in the United States ended around 2003, and the cesarean rate has continued to increase at roughly the same pace, slowed down a little bit in the last couple of years. It's said that there's more twin births because mothers are using artificial reproductive technologies, so they're having more twins, and that's resulting in more cesareans because often there's cesareans because of twins. True, except that around 2002 and 2003, that peaked in the United States as well as people got better at assisted reproductive technologies. We don't have the number of multiples that we did before, and that's leveled off, and the cesarean rate has continued to increase. It's argued that those cesareans are going up because babies are getting bigger. That's not true at all. Babies are actually getting smaller. Even if you're looking at singleton births to avoid the issue of twins, the average size of babies has decreased. And it's partly decreased because the injection of early cesareans has resulted in more prematurity. So the final one that's laid on mothers is they're asking for it. That this is simply doctors responding to demands by mothers. And that would be a very powerful argument if it had any basis in fact. The only basis in fact is this. There are clearly a handful of mothers, a very small proportion of mothers who want a cesarean for fear of childbirth, for fear of labor, whatever. But that's a tiny fraction of the number of mothers we're talking about. When we did a national survey of mothers, we found it to be less than 1%. So most of the reasons we cite for the rise in cesareans either are not true at all in the case of birth weight, or have not been true for the last few years as the rate has continued to increase. The question's been raised, what's the concern with the high rate of cesareans? If maybe 33% isn't even high enough. Maybe it should be 100% cesareans among some. But the other side of it is this. Once you pass a certain point, and there's not a fixed number that everybody agrees on, but oftentimes in the area of about 15%, what you find is the outcomes don't improve anymore. When you look at it across countries, those higher rates of cesarean have no actual benefit for mothers and babies for that matter. But when you start subjecting mothers at low risk to major abdominal surgery, you're introducing interventions they don't need. And then what we found was mothers were much more likely with planned cesareans to be rehospitalized in the first 30 days, in the first 90 days, and up to 1 year. Why would we be surprised by that? You do major surgery on people who don't need surgery, and you raise risks of infection that they wouldn't have experienced otherwise. And so the point is not that cesareans are not done well and people don't care about how they do them. They do them with great care. But the reality is doing surgery on people who don't need surgery introduces a set of risks that you don't have to encounter. I don't doubt the sincerity of clinicians who believe strongly in trying to do more cesareans. The issue is how they got to that point, where they came from and how they got to that point. And if you look at the nature of their training is all about risk. And the consequences of that are their behaviors will treat mothers as if they're all about to have a disaster occur. And they don't go home at night saying, ha ha, I fooled all those people. They really believe it. They honestly believe it. And it's that honest disagreement that I find makes it both possible to talk to people and difficult to get people to change. So if you're thinking, where can we make the change would have to come at the training stage. Both in terms of maybe recruiting some different kinds of people whose greatest skills weren't necessarily their score in organic chemistry, but had the kind of compassion and empathy that we want in a birth provider, but also change the way they're trained. There's a wonderful moment in one of the many documentaries now around childbirth where several young obstetricians are asked, have you ever seen a normal birth? And the three of them sort of look at each other and say, well, no. And what does that mean for our system and the way we train the people that we put so much care into?
How often do you get to see a fully natural birth? Rarely. Almost never.
This is why, if you really want a humanized birth, the best thing to do is to get the hell out of the hospital.
Awesome. So your instructor today will be Christina Cheeks. She is a full spectrum doula. She's actually out of Valdosta, and she's been working in Georgia for many years, serving in that doula capacity. And excellent childbirth educator. I just really wanted to come on and share that video clip and then pass the mic on to her. So since you got...
All right. Well, hello again. Good morning. I'm so glad you're here and in attendance. So we're going to be talking about some natural childbirth comfort measures to get you through this wonderful and incredible journey we call childbirth. It is something that is very near and dear to my heart and made me the woman that I am. And the lessons that I've learned each and every time that I was able to give birth naturally strengthened me so much. And it was through all the things that were poured into me during the times when I was pregnant and getting ready to have birth that made me able to, be successful in it. It is not definitely the easiest thing. As I'm sure you know, giving birth, whether you do it naturally or medicated, it's not easy. But if you are wanting to go the natural method, it is possible. It is possible. It is possible. And I'm here, most importantly, to give you the tools and knowledge that you need to make an informed decision, no matter which way you choose. At the end of the day, we want a healthy mother and a healthy baby and a healthy birth. That's what we want. So again, welcome. I'm glad you're here. And if you have any questions, feel free to stop me. This is not a super formal class or anything like that, so please feel free to jump in. Let's make this a conversation, and let's have some fun. I am teaching on Facebook Live. So if you hear me, talking to both you and my people on Facebook Live, hello, Dr. Moore. Just bear with me. I'm happy to have all of you. Please post your questions in the chat or just hop in and I'll be glad to answer anything that you want to know. So let's move on to, let's see here. And if anybody, the question is, I have some men on the live as well. So the question that I was asking is, what have you heard about natural childbirth? What are your beliefs? Do you know anybody who has done it naturally? And, how do you feel about natural childbirth? So if y'all on the live want to answer that question, feel free to hop in and I'll try to go back and forth between both screens and check in and we can discuss. All right, so let's go on to the importance of comfort techniques. Comfort measures can help you cope, of course, with some of the fears and anxieties you have surrounding childbirth. I like to frame the discomfort not as pain. A lot of times you'll hear people say it hurts, it hurts, it hurts. And it probably does. But I like to frame it as discomfort. Words are extremely powerful. So one of the tools that I'm going to throw in here for, and you'll see this throughout the slides of some of the tools that we can say, that we say are available for you to use are movements and tools, like physical things. But one other tool that we have are our words. It is our mindset. That is another tool that we can use to reframe childbirth and how it feels, how it makes it feel to you, and how your body is processing it to make it more comfortable. So I think that because of the culture surrounding birth in our country, there again, because of the way that birth has shifted throughout, the years. At one time, it was something that was done at home. You had a midwife come to your house. You had family members there. You might have had a sister or somebody in the village or whatever, and you gave birth at home. You were attended by a skilled midwife. I know here in the South in Georgia, we had what was called granny midwives, and these women would get a call, and they'd either walk to the woman's house. They would catch sometimes they'd get a ride if they had to take their mule, their horse or whatever. And they went to the woman's house and they attended her birth. And she gave birth right there. The midwife had her bag. She had all her sterile equipment. And these women were extremely skilled in managing birth for these women and being able to take care of these babies. And so, but as the time went on, birth moved from the home into the hospital. And then, you have also the invention of infant formula. You have the invention of all these other kind of medications and things like that. And just the messaging surrounding, and then you have the shift between from midwifery care to obstetrical care, which really changed how birth was done in our country. And then you had things like feminism that popped in there that really just changed how women viewed birth and how they even viewed how it feels to them. All these things, kind of coming together, which influence things. What we're now seeing is, again, increased fear. You see a super high C-section rate in our country. And I know it varies from state to state. Here in Georgia, I want to say the rate is about 32.1% of births are done via C-section. We have a very high maternal and infant mortality rate. Of course, those numbers, no matter where, no matter where you are in the country, we're going to assume that those numbers are always higher for African American moms and babies. We lose more moms and more infants. We have higher rates of C-section and use of obstetrical interventions. Let's see. Trying to slide down on my slide. But having comfort measures can be effective during both medicated and unmedicated birthing experiences. I like to, again, make sure that my moms have all the tools and all the information that they need in order to make an informed decision. All right. Am I for natural childbirth? Absolutely. Because I know that we are able to do this. Our bodies were designed to do this. However, I think that any mom and any family should birth the way that they feel most comfortable. They should also give birth where they feel most comfortable and empowered. So I am not here to sway in any direction, but as this is a focus on natural childbirth and comfort measures, I am going to emphasize that a little bit more. But again, all in all, comfort measures have a long and strong impact on our birth outcomes. And I think it's important to take into account how important the birth is. Not just, oh, well, I had a healthy baby, that's all that matters. The birth experience matters just as much. And I think we need to put more emphasis in that. And that's why we have classes like this. This is also why we have doulas. This is why we also have, policies that are coming out, Nia, that you're working on to make childbirth a better experience for not only the mom, but the baby and the father as well. So I think all these things come together to make things better. So, and hello, Jason. And like I said, y'all, if y'all have any questions or have any comments, hop in. Nia, hop in if you got any questions or want to add anything. So let's talk about this birthing environment. This is one of my biggest things. I think that is super important, and I don't think enough emphasis gets placed on this. Our birthing environment, right? The average hospital, a hospital birth, you will come in and there is a whole bunch of people in that room. And you're sitting there, especially me as a doula, I'm speaking with my doula hat on. I know that there have been many times when I have walked into a room and a mom is there and she might have just got to the hospital. She's getting monitored. She's getting all the things put in her. And there's like 7 people in the room. And when I talked to her on the phone, as she was getting ready to go to the hospital, her contractions were coming regularly. She was feeling this way, she was feeling that way. And then when she got to the hospital, there's like 7 people in the room. And then I'm asking how she's feeling. She's like, oh, I'm fine. My contractions have slowed down and all the things. And I'm looking at all these people and all, and I'm like, well, I could tell you why your contractions have probably slowed down, because you have so many people in the room. And now, you have all these people watching you like a pot of boiling water, waiting for things to progress. That is not how this works. A lot of times our labors progress better and faster when we are in a more controlled, quiet environment, when we're in darkness, when we have comfort, when we have peace, when we have people that are familiar to us. That is how our labor usually progresses a lot faster. I think that your birth environment matters significantly. Energy is a real thing. All right. So you want to have whoever you invite in your birthing space, whether you have one person, whether you have 10 people, they need to be people that are super close to you. They are supportive of your wishes. They come with good energy. And, we're talking vibes. We talk a lot about vibes now, that they need to have good vibes. They need to be on the same page as you. So this might look like them knowing what your birth plan looked like. And I'll talk a little bit more about that, but having them be familiar with your birth plan or your birth wishes and preferences is important too. So that way they're able to advocate for you. And as you see on the bottom of the screen, doulas, yes, Nia, me and you, doulas are important. We play a critical role in creating the birth environment, designing the birth environment, and most importantly, maintaining the birthing environment for our client. Because what we don't want our moms to have to do is think or use their brain. All we want them to do is focus on having their baby. So what we're going to do is we're going to be reviewing her birth plan. We're going to know if she wants music and candles or lighting, if she's going to want to use aromatherapy, if she's going to be able to use movement and be able to walk around to help her manage her discomfort. Can she use water for comfort? And that goes into knowing the protocol at the place where you're giving birth. So this is why it is important to, like I said, create a birth plan, discuss your birth plan with your care provider ahead of time. So that way you two can go through it together and know what's possible, what's not possible, or find a middle ground or a way to compromise. And I think too, we're on the previous slide, we saw a lot of things about fear and anxiety. One of the things that you can do to release that fear and anxiety is to make sure you take a tour of the hospital, doing the hospital birthing classes. Attend those too. I don't care if you take 5 other birthing classes. Don't skip the hospital birthing classes if you're giving birth at a hospital. That getting used to the environment, getting used to the smell, getting used to the care providers. And you don't have to just go up there once. You can go up there as many times as you like. I have had moms where I've taken them to the hospital several times and got them used to going there and knowing where to go, where to park, getting used to the people at the nurses station, getting them used to the smell of the hospital. Some of our moms may have had trauma or things left over from another experience that make them fearful of going to the hospital. So this is where you as a doula, and if you are a partner, if you're a father and you're supporting someone who is going into a hospital to give birth, ask them how they feel about hospitals or the environment where they're giving birth. Ask questions, talk with your care team, and most importantly, craft a birth plan so that they have a say-so in how the experience comes out. Looking at my notes here, making sure I'm not forgetting anything. And again, birthing is not a spectator event. A watch pot does not boil. So I like to advocate, again, like I said, just having only the key people in there. Less is more. And also just in case something does progress very rapidly and, things need to move in a different direction, you're not having to control who's leaving, who's coming, all these things. Because birth sometimes can be a very unpredictable event. And sometimes decisions need to be made very quickly. And what you don't want to have to do is the mom and certainly the father and the doula what we don't want to have to do is pick and choose who can be there. And, you know, that can get really messy as I'm sure you can imagine. So you know, this is where you might have some people come to the hospital and be in the birthing room while she's having the baby. And then you can have another set of people who you might welcome after she has the baby when she gets transferred over to postpartum. The same can be done for home birth or birth center birth. You can have those people who are able to come during the childbirth, you know, the actual birth, and then those visitors who are going to be able to come postpartum. So again, controlling your birthing environment. Know the hospital protocol. Does the hospital allow you to have music? Can you use aromatherapy? Can you do, you know, you may have seen some women get super creative and make this like this beautiful place, especially in the hospital birth. But can they use the string lights? Can they use the LED candles? Can they use water? You know, can she go in the shower? And that might be one of the things you talk to the staff about and say, hey, I know that I want to use water. Water helps me feel good. What can be done to help me accommodate that? So that might look like you asking them if you can have remote monitoring while you get into the shower. They have the tools where they have the little Doppler and they can come and read the mama's, listen to fetal heart tones right there with the Bluetooth LED monitor, whatever. And they can listen to everything right there without mom having to be strapped down in the bed. So again, knowing hospital protocols and what's available to you and trying to find that middle ground so that you have the tools and know-how beforehand. So that way there are no surprises when you're there. So any questions? What has been your experiences, Nia, if you want to share, with supporting someone and helping them have an optimal birth environment?
Yeah, thanks for asking. I definitely have done my fair share of birth plans and talked about desires around comfort in the birthing space. My most recent client wanted access to a birthing pool, and she knew that the hospital she was giving birth at would have one, wanted to use essential oils, wanted to have affirmations. We had a curated playlist for her with all of the songs that brought her a sense of peace and or empowerment. And she was able to move around. She didn't have to do continuous monitoring. So we were able to work around those things. So one thing I wish listening to this now, I wish I would have encouraged as her doula would have been to get more familiar with the hospital space. Because though she had a look at the labor and delivery room, she didn't know when she came to the hospital, her water had already broken and they brought her through triage. And I think just kind of that waiting period before they took her to the her laboring room, made her a little bit more anxious. So her blood pressure spiked, and we know what happens when the blood pressure goes up.
Yes.
Yeah. So that's one thing I'm like, I wish she would have been able to put her eyes on that. I would have known that maybe she wouldn't have gone straight to that room as maybe she thought, but would have had to kind of had an intermediary period.
Absolutely. And that's real. And speaking of that, one of the things that I would like to, and this is going to be a mental note that I'm going to make, is getting my fathers more familiar with the hospital as well. I don't think enough emphasis is focused on or put on how men process the birthing environment and in space too. I think we can do a better job with checking in with men and asking them how they feel, how they can be best supported, what are their needs as well. And even showing him little things of like, this is where you park. This is where you bring her when she comes into the hospital. This is what you say. This is who you ask for. And even showing him something as simple as where the cafeteria is, so he can go get some food and some snacks. Teaching him what to pack in his bag for him. We talk about what the woman should pack in her hospital bag for her and baby. But a lot of times dad might be at work, he might be across town, he might be, you know, whoever knows. And then he might just be so caught up in the excitement of everything that he may just forget to bring his bag. And so it's teaching him how to also prepare himself for this upcoming experience so that he's able to be comfortable. And when he's comfortable, he's able to show up for mom better as well. And not only for her, for himself, because men also process birth too. And how they feel about the environment is important. So I think as doulas, we can certainly focus on the mom, but making sure we're doing those frequent check-ins and touch points with dad to ask them how they need to be supported and what tools they need and what questions they have, and just helping him get better prepared so that he's able to take more of a leadership role and not just feeling like he has to step back and let the nurses and the doctors or the midwife or whoever, or the mom or the sister, you know, take over, and he is just kind of a wallflower, just thinking, well, I have nothing to do. They got it, you know. And a lot of men, I feel, really want to participate and have a hands-on, you know, role in this, but a lot of them just don't know what to do and how to advocate for themselves. So again, like I said, supporting these moms, but if there is a male present, just making sure we're touching in with them and welcome him into this space, and making sure that he's well supported as well. I think that's critical. So those are my thoughts about the birthing environment. I think even if it is not home, if you're birthing in a hospital, whatever, you can make it your own. It does not have to be this sterile room. It can be very beautiful. If you look on Google and type in, you know, birthing environments for hospitals or whatever search you want to put in there, people have been really, really creative with making it, you know, transforming the space and making it look like a whole different, you know, I've even seen people take the little, what do you call those little things? Those projectors, like the little, like the stars, like the galaxy projectors. They'll turn off the lights in the room and they'll plug up the little thing where you can shine the lights on the ceiling. I've seen people do like strings of birth affirmations and tape them on the walls. They've brought aromatherapy. They've brought the little LED candles. I mean, all sorts of things. And it could be something as simple too as packing your own pillows, packing your own robe, wearing your own clothes. You don't have to always change into the hospital gown. You can wear your own clothes. It can be bringing your own coffee cup. I know having my own cup when I'm drinking my coffee or whatever can be really comforting for me. Make it, like you said, Nia, having a curated playlist. Music is a wonderful tool in creating a really nice birthing environment. Bringing your own blankets, bringing your pillows, your socks, your slippers, a whole slew of things. So those are all the things that can go into making your birth space your own. And that's what I want to see, more families empowered and having a say so in this experience. So let's see, let me check the chat. Y'all are a quiet bunch on Facebook Live. I need y'all to talk. All right, let's talk about some of the comfort tools. So comfort tools like the birth ball, the stool, the squat bar, along with rocking chairs can be used to alleviate pain. This is true. These are some of the things that we have that are common in a hospital. A lot of times you may have to ask for these things because in the hospital, and let me go ahead and preface this by saying my default, let's just go ahead and assume that I'm talking about a hospital birth for the remainder of these slides. And then I'll also add how this could be modified in a home birth or in a birth center setting. But most of the births, of course, are done in a hospital. So let's look at it through that lens. In the hospital, most of the time, if you're using any of these tools, the birthing ball, the peanut ball, the squat bar, a lot of times you have to ask for these tools. They are not always readily available and laying around. Sometimes they are kept in a storage closet and they can be really elusive to find. So just asking for them and advocating for yourself to make sure you have these, or you can buy your own. A lot of these tools, minus the squat bar, are available at Ross, TJ Maxx, Academy, Walmart. You can even make your own sometimes. Like if I've seen some moms use different tools, like taking a sheet, finding a door, and putting the sheet inside of the door and closing it, and then using it to hold on to and get in a full squat, so that she's able to rock and sway and use that as kind of a like a, I can't even think of the word, but where it's kind of hanging down, and she can use that as a tool to make herself dilate and take the pressure off her hips. And just, again, knowing the hospital protocol, if they have any restrictions surrounding using any kind of comfort tools, are there any health risk factors with the mom? You know, is she a scheduled C-section versus, or if she's having an induction, it can also mean, and I've had births where the mom wanted to use certain comfort measures and tools, but because of something that may have been abnormal with her birth, maybe they were trying to stall the labor a little bit and not have her dilate. The hospital staff advocated against using certain tools. So knowing what the situation is and what comfort measures and tools are best used to manage her discomfort at the time are critical. And again, I think this is where having a birth plan is extremely important, so that you can know what to do in the case that we have a different situation come about. So that way we're not having to make decisions off the top of our head. We already have something kind of in place to guide us on how that would look like. All three of these comfort tools are extremely important because, as you see, it keeps mom off her back. It gives her movement. She's able to control what feels good to her. She's able to move around, switch, and move along as she feels the need. One of my favorite tools, and it can be used in a variety of different ways, is the birth ball, because you can use it prenatally. You can use that to, instead of sitting in these hard, rigid chairs, you can use those throughout the pregnancy, and it will help relieve a lot of back pain, a lot of pelvic pain. If you have sciatic nerve pain, you can use that. It also, if you're, and I'm doing the movement here, if you're sitting on the birth ball, you can sway, you can practice that swaying, that twirling of the hips and rocking that you will naturally do when you're in birth. So it won't be so unfamiliar to you when you are in the birthing environment. Birthing balls are also important, very useful tools postpartum, because you can use them to hold your baby or rock your baby to sleep if your baby's fussy. If you are dealing with pain on your perineum or whatever, perhaps from an episiotomy or any kind of trauma that was done down there, it's a lot more comfortable to use a birthing ball instead of a hard chair. You can use a birth ball in a variety of different heights. And I've seen moms take a birth ball and stick it up against the wall, and they've kind of, let's imagine the birth ball is behind you, that she's used that and just kind of leaned up against it and kind of rocked and swayed, and she was able to get more into a squatting position. I've seen moms take, I'm going to use my tools here. So if this is the hospital bed right here, I've seen moms take the birth ball and put it on top of the bed, and she's been able to lean on the ball, and she's been able to stand up and just kind of rock and sway. And then what she was able to do was have somebody come behind her. I'm kind of improvising here. So this is the mom, and this is the ball, and she's
swaying and leaning on the ball. She's resting her head. And then we had somebody who was able to come behind her, and they were able to give her a double hip squeeze as she's rocking and swaying, because again, her back and her bottom is exposed here. So we've had somebody come in and be able to give her a double hip squeeze. We've been able to have somebody give her counter pressure. We've been able to have somebody come in and rub her back. And all sorts of things. And then again, like I said, when she's able to use movement and be upright, this keeps her pelvis open. This helps the baby come down and get into more of an optimal fetal position and able to put even gravity on the cervix to encourage even dilation. So those are some of the ways that a birthing ball can be used. That is not an exhaustive list of how it can be used. But if you have a stool, it can be just like a medium-sized stool. If she is having some cervical lip, meaning that her cervix is dilating unevenly, it might be dilating faster on one side and a little slower on the other side. A birthing stool can help her where you can put it on the floor, and she can just kind of and I'm trying to do this so y'all can see. Nia, let me know if you can see what I'm doing. But as she's stepping on the stool, she has one foot on the ground and one foot up on the stool. I might use you, Jordan, for demonstration. My daughter just popped into the screen. But she can step up on the stool and just kind of do a sideways sway. And what this can do is open up the pelvis and put more pressure so that the baby's head can open up that cervix a little bit more and get rid of that cervical lip. This can also be used if we have a baby who is in a funky position, or we're trying to get the baby to rotate a little better. If we're trying to get rid of some back labor, she can use that birthing stool to get up there and help trying to turn that baby. And then, of course, whatever we do on one side, we're going to want to do on the other side as well. What else can we use the birthing stool for? If you don't have a stool, if you're at home, let's say you're walking around, you're doing a home birth, or you're getting ready to go into the hospital, and if you want to do some walking, go outside, go find a curb, a sidewalk, and as mom's walking along, she's going to be walking, and one foot on the sidewalk and the other one on the pavement. And that way she can use that to do the same kind of movement. And then, of course, you're going to do that on the opposite side as well. So, Barry, can I use you for demonstration real quick? Yeah. Okay. So as I was saying, I got a volunteer. So this is my daughter, Jordan. All right. So what I want you to do, Jordan, I want you to kind of lean over, and you're going to be like this. Yeah. It's okay. So she's gotten shy. But what I was gonna demonstrate was the double hip squeeze to show y'all what it would look like. But again, just imagine she's lying over just like this going back to the birth ball. She got shy on me, y'all. So if you had a big old giant birthing ball, you're leaning over, she's resting mom's back, her hips are exposed, and then what you're gonna do is go in and do a double hip squeeze. And that's a technique that I'm gonna show you in the slides coming up, and maybe I'll be able to convince her to be my demonstrator here. Maybe I'll convince her with the trip to Five Below. But anyway, you can also use a rocking chair. If you have a rocking chair, that rocking movement will help move that pelvis, move the hips or whatever. Any kind of movement is what we want. Hello, daughter. And if you have a squat bar, this can be one of the things that is a little harder to find. The squat bar goes onto the hospital bed and it clips onto there's two little holes on the side of the bed, and it clips in. This is a great tool because it can be used in a variety of different ways. As you can see, the mom is able to kind of get upright. She can also turn around outside of the bed. And these hospital beds can be modified and moved in a variety of different directions too. So this is where a skilled doula comes into play. because we are really good at maneuvering the bed and knowing all sorts of tricks that maybe parents may not know, or even sometimes the nurses may not even know. We are able to use these beds and use all these tools in a variety of different ways to get this baby out and keep mama comfortable. We are able to help her avoid tears, episiotomies, C-sections, and other interventions by simply using some of these tools to alleviate discomfort. So let me check the chat. Nia, do you have any questions or comments?
No, ma'am. I'm just enjoying your presentation. Thank you.
You're very welcome. I can't believe my daughter got shy on me. She's like, yeah, I'll help. And then she's, I guess when she saw that I was recording live, she got shy. But all right. Let's talk about some other comfort techniques and measures. So again, like I said earlier, we have rocking, we have the squatting with partner, we have a full squat, we have leaning forward. The leaning forward position is one of my favorites, and I'm gonna turn my screen for my people on Facebook Live. But these are some of the positions that you can use. The leaning forward one is one of my favorites. I will certainly use this position right here, leaning forward, for a mom who is having trouble dilating. She is feeling fearful. Maybe she's afraid of the pressure and the sensation of a lot of pressure on her perineum. Maybe she has an urge to push. Maybe she has the urge to push and doesn't know how to push. This is a great position. The way I would use the leaning forward position is I would get her on a toilet. And I will put some pillows. If you look on the right here on the back of the chair, imagine if this was the back of a toilet. I will put some pillows back there so she's able to comfortably put her face down. If she needs to bury her face into the pillow for darkness, for her to concentrate, she can. If she's tired, she has, that to rest on. And naturally, when we're on the toilet, what do? We release. Whether you're peeing, whether you're pooping, you release. So our brains are very powerful, and that's how we want to frame this when you're having a baby. You want to release, you want opening, you want the cervix to dilate. And this is a great position to encourage that. What I have seen is a lot of moms who were dilating slowly, when I put them on a toilet, within minutes, we saw rapid progression of the cervix opening, and we were able to get that baby out a lot sooner than if we would have mom in the bed, on her back, or in any other position. So this is, of course, a lot of people think, well, oh my gosh, what happens if I give birth on the toilet? I promise you, you will not give birth to your baby in the toilet. Your baby will not fall in the toilet. We are going to get you off the toilet before you have your baby. Fear not. We are very knowledgeable and knowing by sounds and everything of when birth is imminent, and we are going to try to move you away from the toilet. And and if you are very close, there's nothing like a midwife or an OB coming in there with the chucks pad, ready to catch that baby as you're standing up, or however. Birth can be done anywhere, but we're not going to let that baby fall out in the toilet, y'all. Okay. So anyway. Kneeling with the birth ball, we can use that. If you want to get on the floor, if you're at home or even in a hospital, we can put some chucks pads down on the floor, and we can get mom on her knees, and she can lean on top of the ball. We have the cat-cow or hands and knees that we can use here. If she wants to get in a semi-sitting position with her partner, this is kind of hard to see, but her partner is standing up behind her, and the mom is on the birth ball. She's kind of in a half squat position. And she also wants to lie on her side, and she can use either a birth ball, she can use a peanut ball, and she can even use pillows to get in a sideline position. And she can have someone hold her leg as she's lying on her side. There's a lot of different ways that we can use these techniques. A lot of the reason why these techniques are great is because it keeps the body open. It allows her to have extra support so that we're able to have somebody come in and do the double hip squeeze. We're able to give mom counter pressure. We're able to give her massage and touch. And again, movement is her friend. Whenever you're feeling any kind of discomfort or pain, we do not just sit there and take it. A lot of times when we're not feeling so good, we move. That is our body's way of moving away from the pain and trying to reframe it in our minds. So movement is important. And most importantly, knowing how to use your tools is important too. And the other one that she has down here is rhythmic breathing and moaning. All right. I like to say, ladies and gentlemen, boys and girls, that if labor is progressing well and if mom is coping well, it is going to sound a lot like it sounded when she was getting the baby in there in the first place. Okay? Yes, I said it. My daughters heard me say it. It is going to sound a lot like she's having amazing sex, the very thing that got the baby in there in the first place. It is okay to moan and groan, okay? Some moms may have, you may hear some moms screaming, or you may hear a mom curse. That is okay too. People process this in different ways. The one thing I like to see is rhythm, and routine. Is really helpful in order to help you get through this process, because contractions come in waves. Okay. And I actually don't like to even call them contractions. I like to call them waves, because that's exactly what it is. If you look on a fetal monitor, the contractions look like waves. So we're going to call them waves. Like, remember how I said, we're going to reframe them, and how language can shift the way we process stuff. And language is also very powerful. So let's call them waves. Her waves are going to come in rhythms and spaces. They're going to have a resting period. Then she's going to go back up the mountain. When she's in the middle of one, she's going to peak over the mountain. This is when it gets the hardest. And then when it's over, it's going to come back down. And then she's going to have a valley of rest. And then she's going to have to climb that mountain again to the next one. She's going to get to the top, and she's going to go back down. She's going to have another valley of rest. So this is why rhythm, repetition, and routine is important. And we know that each one gets her closer to having her baby. Each wave has a purpose. It means that the cervix is opening. It means that we're seeing progress. It means that the baby is descending through the pelvis and getting closer to the cervix. It means that we're getting ready to push. So we're looking for progress. Okay. And if she is using sound and moaning, what we're wanting to do is encourage her to have more of instead of a high-pitched moan or a scream or a groan, we're wanting to get it low. All right. And you can practice this. I won't judge y'all in your houses. I can't see y'all. I can't hear y'all. But if you think about it, and I'll demonstrate myself, if you're screaming like with the high-pitched sound, as you can see, I tensed up. You could try it at home. Like I said, try it. If you're in pain, a lot of times we go ouch, or you see naturally tense up. But if you moan, and if you have more of a lower tone, what happens is your body loosens, your jaw, your forehead, your forehead, your chin, your eyebrow, your brow, your shoulders, your throat, your stomach, and your cervix opens up when you use more of a lower sound. And this is not only a tool that can be used in childbirth. You can use this anytime you're feeling kind of any discomfort or pain. Instead of using more of a high-pitched sound or whatever, try to focus it downward and out. And those same techniques can help open the cervix. So again, instead of and that, when she gets that rhythm and routine down, I'm telling you, it makes a world of a difference. And you, as the doula, as the dad, as the grandmother, as the best friend, as the sister, if you get in there and if you do that with her, she will feel even more supported and she will feel more comfortable using those sounds, because a lot of us think like, oh, this is weird, making these sounds, people are going to judge me. But if she hears other people doing it with her, it makes her feel safe, and she will use these techniques, and it will, I promise you, it'll help move the labor on a lot faster. And if you encourage her, hey, just like that, keep doing that sound, keep doing that rhythm, keep doing that routine, you're doing a great job. Give her verbal encouragement. And if you see her doing something that needs to be corrected, like if you see her tensing up her shoulders, if you see her furrowing her brow like this, what you might say is, drop your shoulders, unclench your brow, loosen your jaws, drop your shoulders, relax. And if you just touch her, you'll get to the point when you're going through this routine and the birthing process that you really won't even have to talk to her. All you'll be able to do, all you'll have to do is just touch her forehead. You'll touch her jaw. You'll touch her shoulders, and she'll automatically know that she needs to release the tension. And that's the way of communicating without having to use any kind of sound or words. So those are some of the tools and techniques that you can use to keep her comfortable. Any questions or comments? Facebook, I need y'all to talk to me. Nia, what do you think? Do you have a favorite tool or position that you like to use with your moms?
Yeah, I like to, if there's not a squat bar, I like to serve as a squat bar where they can hang on to me and I can support them. Like their hands are at like my biceps, and my hands are at their elbows or their upper arms. And they can like either squat down or lean towards me and swaying their hips, and also encouraging that low guttural sound, because that is kind of I've learned that there's a connection between the mouth and the pelvic floor.
Yep.
When you open the mouth, open the airways, you're also opening the pelvis and opening up the womb space. So I like to encourage my clients to see like wind just kind of passing through their bodies, moving baby down, releasing the tension, and like all that energy just flowing outwards to help them progress.
Absolutely. And the cervix and everything, if you're closed up here, everything flows straight down. If it's even the same thing with sexual attraction. If a lot of women, if we're not stimulated here, nothing works down here. Men, take note. Women like to be stimulated here first before we even get aroused or we get relaxed down here. So if we're able to feel safe up here, if we're able to open up and relax here, naturally everything will work its way downward and open up. So definitely making that mind-body connection, encouraging those guttural sounds, and making her feel safe that it is okay to make those noises. If you need to cuss, it's okay to cuss too. But, we're going to remind her too, the power of your words matters. If we're saying this hurts, and you might say, I know it does, but this is getting you closer to meeting your baby. Each wave has a purpose. And you might ask her, okay, this hurts. Do you want to try a different technique? What do you need me to do? What feels best to you? And making sure you're not asking her these questions in the middle of a contraction. All right. That's an important thing. Do not ask I caught myself. Do not ask her these questions in the middle of a wave. Try to wait until after she's done the wave to ask her what she needs. And this is also one of those things that I wish that the hospital staff knew. Don't ask her these questions in the middle of her having a wave. Don't do that. Wait until she's done and when she gets her concentration back, and then ask her. This is really important so that she's not having to break her concentration. And most importantly, where she's not having to use her logical side of her brain. What we're wanting her to do is getting to the primal side, the raw, open side, where she's doing what feels natural to her and what feels instinctual to her. So, yeah, those are some of the things that I think that we can use for comfort measures. Again, this is not all. So we're going to move into sideline position, as I showed you earlier, and I'm going to show my people on Facebook Live. So this is a sideline with support between her legs. This is a really good position to use if mom is needing to rest, if she is tired, if she has had an epidural. One of the things we want moms to do with epidurals is to rotate her positions at least every 30 minutes so that we're encouraging fetal descent and that we're encouraging her cervix to open up evenly, okay? If we have a tool between her legs, this could be a pillow, this can be a peanut ball. If we have someone holding her leg, this is great because it keeps the pelvis open. And of course, with the opening, encourages the baby to calm down into the birth canal and hopefully encourage optimal fetal position. This can also be a good position if perhaps we need to slow her labor down for any kind of reason. Sometimes baby might be coming really fast, or she might just have some blood pressure issues or whatever. And this is a way to get baby to kind of slow down. So this is a good tool that you can use right here. And if you look at any of these positions, y'all, again, you'll see with the next slide here, the same way you got baby in. All right, you see this? Same way you got baby in is the same way you will get baby out. So let's talk about this hands on knees, on hands and knees position. This is a great position right here because it allows gravity to do its work. This keeps the back and pelvis and hips exposed. So that way, if we're having somebody who needs to come in and do counter pressure, a double hip squeeze, if we need somebody to come in and rub mom's back, and doulas will have a lot of different tools in their bag to help her with the discomfort. We might have a roller. We might have a tennis ball. We might be able to use a cold pack and put it right here on her bottom if she's feeling discomfort. If we need to put a heating pad here, it can be all sorts of things. If we need to get they call them rebosos. If we need to put a piece of fabric underneath her belly and rock her hips, we might put it over the back of her bum and shake the tree a little bit to get the baby to move. If we need to get that baby in a better position, we are able to use a lot of different techniques and tools that we will have available to us. This is also a good position if the baby is what we call in a posterior position, or OP, meaning that the back of the baby's head is pressing against their tailbone, which will cause mom a lot of discomfort. And unfortunately can mean a slow descent and slower labor, which unfortunately sometimes can lead into a C-section, and again have mom in a large, an incredible amount of pain. So this is a good position to use if we need to get that baby to rotate around. Of course, we want to make sure she is safe. So if mom is in this position, we want to make sure she's well supported. This position can also be used if she has an epidural, depending on what kind of epidural she has. But if she does, this is where we're going to make sure we got people on either side of her supporting her to make sure that she is able to control her movement. So you can even take this position and use one leg to kind of lunge forward if she needs to. Again, using a rocking position if the baby's in a really weird position. We can modify this as well. And a lot of moms will instinctually do, sorry, y'all, flip the camera. A lot of moms will use a position that feels good to them naturally in that position. You'll see a lot of them on their hands and knees, kind of rocking back and forth. They might use a swirling position. They might lunge a little bit. they'll do what feels good to them. So again, we're just going to make sure that we're on the watch and making sure that we're using different positions periodically so that we're not stuck in the same position for too long. The next one, the cat-cow position. Any of you who may have done yoga before, this is a good position to use here. This is good for releasing a lot of pelvic pressure, a lot of back pain. This can be used before she has the baby as well. If you hear mama talking about my back hurts, my sides hurt, I'm having sciatic pain, this is a good position for her to use. This is good for getting baby in a better position as well. So you can use this, and you're going to encourage her breathing deep and having her look up, allowing her back to bend naturally, kind of like a cat, you know, like the Halloween cat that you see. This is what you're trying to get them to do. You know, cats, when they get scared and whatever, they get into this like arch position. This is what you're encouraging her to do. She can hold the position up, her back in an up position for a while, and then release. And then as she's releasing, she's going to have that curve in her back, and then she's going to bring it back up, hold it, and then release her breathing. So if you are able to do this with her, get down there and do it with her. Again, having somebody there doing the movement with her is good, and it makes her feel supported. It makes her feel comforted, and it can also give you some relief. Dads, if you're in the room, if you've been in a long labor, if you've been sitting in a chair, you might need some release too. So this is a good thing for you to do to make yourself feel better as well. So, and it's good for everybody. So if you have other little children at home, and if mom is getting ready to have her baby, get the kids to do it with her. That way they can feel involved in mom's care as she's getting ready to have a baby. And if you're wanting to do some pregnancy yoga, there are a lot of different resources. I'm pretty sure you can find in your community that will help her learn these positions and learning how to stretch and move her body. That's good for labor and birth. Deep squatting. This is a good position. This is something that a lot of us are not used to. This is where those good knees come into play. If we can encourage this more often, hopefully earlier during the pregnancy, this is really good. Because what it does, of course, is it gets the pelvis nice and open. It stretches everything. It gets the baby in a deeper position where baby's head can press more on the cervix, allows mobility in the hips and legs, and we help with that rotation. You see in a lot of other countries, people are used to squatting. In Asia and Africa, we see a lot more women squatting and comfortable with this position. Even older women are able to do this with no problem. Us American women, we got a little bit of work to do. But this is where this is a great way to get us back in touch with this position and using it during our childbirth and even postpartum. This is also a technique you will see used in yoga, but it strengthens everything. And if we're needing to get contractions coming a little harder in order to get that dilation moving, this is a great tool that we can use, getting her in a full squat. You can also imagine if she had a squat bar in front of her, if she was sitting in a hospital bed, and if we have that squat bar, she can use that as well. So there are a lot of different ways that we can use deep squatting. And again, like I said, y'all, if y'all have any questions, hop in and let me know. Double hip squeeze, counter pressure. This is your friend. This feels wonderful. Counter pressure helps alleviate back pain during labor. If you hear women saying that she's having a lot of back labor, or if the baby, again, is in that OP position, we are able to have somebody come in and take both hands. And I'm gonna turn the camera. If she is having some hip pain, we're able to come in on the side of the hips, and we're able to squeeze in, and we're going to hold that position. We're going to hold that pressure until she says it's time to release. You do not, and I promise you, in the middle of a wave, if you're doing a double hip squeeze or counter pressure, you do not want to let go in the middle of a wave. You will get yelled at. So practice this a lot. Strengthen those arms and those biceps before she has a baby. All right. Practice that counter pressure and that double hip squeeze so that you'll get used to holding that pressure. She'll let you know how much is too much. And if she needs more, she'll let you know. But this is a wonderful technique to use because it can get baby turned in a better position. It can relieve a lot of that back pain, the hip pain. You can use this prenatally before she even has baby. If mom is talking about her hips hurt, that she's feeling a lot of back pain and pressure, you can use double hip squeeze. And I promise you, it will make her feel 110 times better by just a few double hip squeezes. And it'll get her over that hump. You will be her best friend. Let's see here. Now we're getting into, we're getting into drugs for pain management. There are times where we have to use some medications for pain management. All right. Sometimes you might have to use something like Demerol, fentanyl, Nubain, Stadol. Those are more of the lighter side of drugs that are used for more short-term use. These three at the top here are usually, you'll usually get only a maximum amount of it. I want to say most of the time you might get at least 3 doses. They are meant to be used and work for a very short period of time to help take the edge off, so mom can just kind of regroup and get some temporary relief. You have some hospitals may use laughing gas, where she'll have a mask put over her face and she'll breathe in the gas and it will help her relax. And then you have heavier options like a spinal epidural. And this is usually given before she's about to have a C-section. And this is the heavier epidural. There are times where mom may have to have an epidural and be knocked completely out. That's usually for a very super emergent situation where they're probably having to make a quick decision to save mom or baby, and they do not have time to go through all the other things, and they're having to move very quickly. And then you have your epidural block. I hope I didn't lose y'all on Facebook Live. You have an epidural block where this is kind of a lighter epidural, but it's giving her some localized relief for her to maintain somewhat movement, but she is still wanting significant pain relief. And let's talk about Pitocin. Pitocin is a synthetic hormone of the hormone that we naturally produce, which is called oxytocin. Oxytocin plays a significant role in our labor and delivery. Oxytocin helps us, it's the feel-good hormone. Oxytocin plays a role in producing breast milk and releasing breast milk from our breast. Oxytocin is the hormone that's also responsible for orgasm in both men and women. Oxytocin also helps lock down the uterus to prevent postpartum hemorrhaging. Pitocin is the synthetic version of oxytocin. And usually when Pitocin is given during childbirth, it is to either strengthen the contraction to make the contractions harder. We're trying to stimulate that uterus to get the contractions to come more frequently. So we're using, a lot of times when you see a mom undergoing an induction, they'll usually give her a Pitocin along with the cervical ripener in order to help her labor progress or start her labor. The risk of Pitocin are that sometimes Pitocin can be given too much, where it can overstimulate the uterus and then cause moms to have super hard and painful waves where she cannot stand the discomfort. And then she is truly experiencing pain. Sometimes when the waves are too strong under the use of Pitocin, it can compromise the oxygen supply of the baby, and sometimes even mom. If she is overwhelmed and baby is overwhelmed by this extreme squeezing of the uterus, it can compromise her oxygen supply. So that's when you'll see a lot of times the mom will get an oxygen mask and they're looking at the fetal monitor and they're monitoring the oxygen of the baby, and then we're having to get the mom there for a C-section because we're seeing the baby's heart rate drop. So, and sometimes if we're using too much, if we're using Pitocin for too long, and if we're not regulating how much, this can cause a uterine rupture, especially if she's had a previous cesarean section or she's had multiple cesarean sections. We're not wanting to see the overuse of Pitocin. The other side of Pitocin is that it is used a lot of times as hospital protocol to prevent postpartum hemorrhaging. A lot of moms are opting out of the use of Pitocin because they want their bodies to naturally produce oxytocin. Pitocin can also override the body's natural ability to produce oxytocin as well. So those are some of the things that you can discuss with your care provider and having your birth plan, so that you know that if you don't want automatic Pitocin, or if you had to undergo an induction, maybe use a different method of induction instead of Pitocin. This can be, Pitocin use is a whole class in itself. I can go on and on and on and on about the use of Pitocin, but I highly encourage my moms to research and ask questions about the use of Pitocin before that is even put on the table, because it does have risks to both mom and baby. But when they're used properly, it can save mom or baby's life. So again, it's about using your tools, knowing the risk and benefits of them, knowing when it's appropriate, asking questions. And one of the things that I like to encourage my moms to do is use the BRAIN acronym. Anytime any kind of intervention is being put on the table, you're going to ask about what the benefits are, the risk, what does your intuition tell you? Alternatives, intuition, and what if we do nothing? So that's where the BRAIN acronym comes in. Benefits, risk, alternatives, intuition, and if you do nothing. That's something that you can use when you're making your decision about how and what interventions, if any, you are going to use during, before, and after childbirth. So like I said earlier, we were talking about epidurals. An epidural is, it's a numbing agent, which that's injected directly into the spine and numbs the body from the waist down. They are generally safe. You're going to have an anesthesiologist coming in and administer the epidural. They're going to sterilize the area. She's going to be bolus with some fluids before she's given an epidural. So this is where anticipatory guidance comes in. I highly stress to my moms, especially those who say, I don't care what nobody says, I'm getting an epidural as soon as I get in there. I don't care what nobody says. I want an epidural. I want an epidural. I want an epidural. Baby girl, that epidural may not come right away. Okay. You have to often wait until the anesthesiologist is available to get to you to give you an epidural. Your anesthesiologist may be caught up in a surgery. He might be in a C-section. He might be in an oncology unit. You never know where he or she may be, and when they're able to get to you. And until then, you have to be able to cope until they're able to get to you. And then when they get to you, the epidural does not work immediately. All right. There's a lot of things that has to go into play before you can get an epidural. There's a lot of consent. There's a lot of explanation that has to go on. There's a lot of monitoring that has to go on before you can get an epidural. They have to make sure your blood pressure is okay. They're looking at those fetal and maternal heart tones. They're looking at your platelets, making sure that everything is good and sound before they're administering an epidural. Every person, every candidate is not a good candidate for an epidural. So everything has to be in alignment before this can happen. So again, it's that anticipatory guidance and knowing how it flows before it can be administered. Some of the risks of having an epidural are, of course, if you can't feel yourself move, that means your mobility is limited. So your ability to use the birth ball, your ability to use walking, your ability to rotate is compromised significantly, especially if you may not have a support team in there. You're kind of on your own, are very limited in how you can move around and use gravity to help you during this process. So, and again, the most common intervention or outcome with the use of an epidural, especially if you combine it with Pitocin, and especially if you triple it with an induction, is the increased risk of cesarean section. This is very often the outcome. And then after that, postpartum, your delayed onset of breastfeeding, initiation and duration of breastfeeding, the higher rates of postpartum depression or perinatal mood disorders, the increased risk of episiotomies, which is basically where the perineal tissue has to be cut in order to get the baby out. There's a whole other host of aftermath and effects of the use of epidurals that people need, moms need to be aware of before they consent to an epidural. So let's see here, moving on to the next slide. Oh, well, it looks like we are at the question and answer session. So that is basically wrapping up the class. So if you have any questions, or comments or thoughts, please share.
Hi, I'm Miss P. I want to introduce you to PIC'L. No, not this. I'm referring to the Pregnancy Information Circle and Learning Childbirth Education series taught by community doulas. Come learn with me about pregnancy, birth, and beyond, one bite at a time.